What are the costs associated with scoliosis surgery? When patients are diagnosed with scoliosis, especially severe scoliosis, a lot of times they can be recommended scoliosis surgery. And unfortunately, when we're looking at scoliosis surgery, a lot of patients are not only considering the implications of what scoliosis surgery can have on them, but they're also concerned of what the cost could be. Not only the cost physically for the surgery, but also what the cost could be over time, meaning with the health of the body, and also what kind of limitations it can create for them long term. Scoliosis surgery is very designed to be something called spinal fusion. And spinal fusion is exactly what it sounds like. The goal is to fuse the spine. And the goal of fuse the spine is to stop and slow progression. That's the primary goal. Even though with scoliosis fusion and scoliosis surgery these days, there is curve reduction in most cases, but the number one goal is to stop and slow progression. Now, is it necessary to have surgery to treat scoliosis? And no, it's not necessary just to have, that's the only treatment option. There are other treatment options in terms of treating scoliosis, meaning different treatment approaches can produce different treatment results. Meaning if your approach is surgical, then yes, then that is going to be your treatment option of choice, is to do surgery to help reduce and manage the patient's scoliosis. But if your treatment approach is conservative, meaning using therapy, exercises, and rehabilitation, then your approach is going to be more conservative in nature and trying to avoid from patients having surgery. So different approaches will equal different results. So the doctor you choose as your primary scoliosis doctor will typically have an influence on what your end results would be and your end approach would be. But scoliosis surgery is not the only treatment option for scoliosis. There are other options. So if you're considering scoliosis surgery, what are the costs? Well, it depends on lots of factors. Obviously, it depends on the size of curve, where it is, how many bones you have to fuse, how big the hardware is, how many doctors are needed, if there are any complicated conditions, is there anything other factors that could be involved. However, we know the cost can be anywhere from $100,000 to $250,000. Looking at the average cost, probably between $110,000 to $130,000 minimally for this spinal surgery. And in the spinal surgery, this is typically for the initial scoliosis surgery. I mean, this is you going in, getting the surgery, and going out. It's not really looking at all the other costs that could be associated with post-surgical treatment, post-surgical complications, long-term complications as a result of surgery, surgical revisions over time. It's not looking at all those other costs that could be possibly associated with surgery, but we're looking at somewhere around that range. The main factors to determine this cost, whether it's on the low end or high end, is going to be obviously the severity. It's going to be the complications that are associated with it, how much hardware they need, and of course, how long your hospital stay is. And that's really going to be the number one thing. The longer your hospital stay is, of course, the more costs that are going to be associated with it. I mean, I think most people understand that it's minimally $10,000 per day just to be in a hospital. So we're looking at, if you're there 10 days, it's going to cost more than if you're there just 5 days. So the length of stay is going to be directly related to the overall cost. But there are very specific costs associated with scoliosis surgery, anesthesia being one of the main ones, right? And the anesthesia process associated with scoliosis surgery can be quite expensive, because most surgeons will take anywhere between 2 to 6 hours, depending on how severe the scoliosis can be. And being under anesthesia that long will drive up some costs associated with it. Of course, you have to have that, because there's no way to have scoliosis surgery without anesthesia and proper anesthesia. And that tends to be the most complicating factor, because patients can have a complicated reaction to bad anesthesia. So that's something obviously that you want done right. Just having the operating room available for the surgeon to use, there's costs associated with that. Different hospitals have different costs associated with using their operating rooms. And of course, the surgeon has his own fees. And of course, the cost of the specific hardware involved in implanting those screws. And sometimes is it the surgery just going to be hand guided or robot guided? That can also change the fees associated with the scoliosis surgery. So, but like I said, there's a lot of fees or a lot of costs associated with scoliosis surgery that are not monetary. One big cost is going to be what your spine is now doing as a result of that surgery. you lose spinal flexibility, you lose spinal motion, you lose the ability for the spine to function the way it was initially designed to function. The spine is 24 spinal joints. It has discs and facet joints, and these joints are designed to move and be flexible, and that what means a healthy, functioning spine. Spinal fusion, you lose the normal motion. So it's kind of like getting your elbow, saying that you have an elbow problem, fusing it together. Your elbow is now straight, but it can no longer move. So the cost of that treatment is loss of motion. It's no longer functioning the way it's supposed to. Secondarily is that the spine now, since it has hardware, that injuries could possibly aggravate the hardware associated in that spine, meaning leading to more weaker or more concerning about getting into injuries over time, which can lead to problems of the hardware coming loose or affecting the spine over time. I've had many patients that have had hardware become loose or aggravate or become injured and come out of the spine as a result of either injury or just time. So therefore, that's one of the costs associated with it, that once this is done, you're going to have the cost associated in managing this curve over time. And the cost, meaning mental cost, injury cost, more prone. Also, you have restrictions in what you can do on a daily basis because you have this fusion going on. So one cost is going to be the restrictions that you have in your lifetime as a result of having surgery and fusion. And then, of course, the last cost is the unknown of the future. What we really don't know is what happens to patients 30, 40, 50, 60 years after spinal fusion, scoliosis fusion. We have no idea what happens to these patients. So there's this uncertainty and this unknown weight on patients that they're concerned about what's going to happen to their spine over time. It is almost definitely weekly I talk to a patient that has scoliosis surgery and they're in their midlife range, and they're concerned about what's happening because they feel differences occurring, they feel problems, and they're concerned about options. Because once you have scoliosis surgery, another cost that's not monetary is now you have less options when it comes to treatment, because now you have a huge rod in your spine with screws, and that's going to limit treatment options, because now the spine is fused where it's supposed to move, where if you just had scoliosis, your treatment options are way more open because you don't have hardware that we have to deal with and consider in treatment options. So if you're considering scoliosis surgery, understand that there are some things in life that you can change. That you can change your mind. However, when it comes to scoliosis surgery, it's going to be in your spine. Now you're dealing with the effects of that for the rest of your life. There's no going back. So research all treatment options. Because once you have scoliosis surgery, it's very, very difficult to manage any other treatment option, and normally you have much less of them, and the costs are very high, not only monetary-wise, but also non-monetary-wise. If this is something that you're looking at that you may not want to do, and then I would definitely recommend you research all your options in less invasive treatment options like what we offer here in Scoliosis Reduction Center. We offer very good surgical alternative approaches, even for surgical level curves, to try to get their curves reduced and manageable below surgical levels. And even for patients that utterly refuse surgery, they don't want to deal with the consequences of it. They utterly refuse it, and they want something to manage your scoliosis as opposed to just letting it worsen. We help these patients at least manage the curve, even though it's a severe curve, and it's a curve that we know that we're not going to get below surgical levels. The patients would rather deal with the consequences of their scoliosis than the unknown consequences of their surgery. So we help those kind of patients too. But if you're considering it, the number one thing is definitely research all your treatment options before you jump into it, because once you have scoliosis surgery, it changes your entire ballgame when it comes to treatment options of your scoliosis in the future. So that is definitely my number one recommendation. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.